What's up, everybody? Happy Monday. Can you believe it is April the 11th? Where's time flying? Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster, with my co host, Dr. Marilyn Corder, today. And you can see she's doing what she's supposed to do. She's going to pick up my other cousin, her son, and they are about to be in town, which is excellent. But with that, saying all of that, I hope you all are having a wonderful day. The weather's beautiful outside, right? That doesn't mean you can't listen to Real Talk Chronicles. So bring your behind back in the house. And I just want to run down some of the sponsorships. Real Talk Chronicles is sponsored by Melba's Soul Food Restaurant on the 114th and Frederick Douglass. It is sponsored by Leon Ellis Chocolat Restaurant on 120th and Frederick Douglass. It's also sponsored by Leon's clothing line, Harlem Urban Wear, which is awesome. I got some shirts I'll show it to you. It's sponsored by the Deli Arts Magazine. Get your magazine. It's at Amazon. So please, number one martial arts magazine for those that are definitely into the arts and you want to read up on people and their history and how they became a martial artist and stuff like that. It is also sponsored by Ingram Taxes. If Ingram Taxes come in today, Jacob and them, please put your the information in there. There isn't any taxes that they can't do. Celebrity, regular John Q. Public, Ingram Taxes. Get your taxes done. And we have Reggie Wells quality sound speakers. If they go for $85, but if you mention Real Talk Chronicles, you can get them for $75. But you got to mention Real Talk Chronicles. How about that? I'll bring them out a little later. I'll go through them. And of course, last but not least, Soft Illusions Fine Art Gallery. That is my wife. And her mother, Art Gallery. So, definitely. With that, saying all of that, getting all that out, I'll do that periodically throughout the show. I'll name one or two of them. But I just wanted to get that out the way. So, let me ask the doctor. Oh, wait, first and foremost, you know how this is done. If you're on YouTube, subscribe to it. If you're on Facebook, whomever you're watching it from, share it and let people know that we have it and you can subscribe to it. Shout out to everybody chiming in. I see you, Tracy, Stefania, Marlene. How's everybody? She says, how are you? She said, it's a beautiful day out. Yes, definitely was. Hello, hello, hello. So let me ask the doctor, how are you doing, Doc? You driving? I know you focus on the road. How's it going?
I'm fine. This is Washington, D.C. at its finest. Anyway, I'm gonna go to the airport.
You on one of them fives?
Yes. See the monument?
You on one of them fives?
Yep.
Exactly.
So I don't know.
Which five are you on? I know it's
my son always tells me I hold a camera like a toddler. You probably couldn't see anything, but I was trying to show you the monument. But anyway, well,
So which five are you on? Are you on 295, I-90? Which five are you on?
395.
395.
That connects DC to Virginia, and I'm about to do the Reagan National Airport. Okay.
Oh man.
Yes.
Let me tell you.
Yes. So
let me tell you something. If you don't know about the DMV area, everybody, there's a bunch of fives. Those highways on those fives will keep you definitely popping, boy. So
495, 395, 295. That's right. You better know it.
Woo, let me tell you something, cuz them fives will pop, boy. They'll pop on you. So anyway, yes. So listen, I listened to your show the other day, and the Village Talk, and I was blown away by what you and your panel were talking about. And I told you, I was like, and you called me and you was like, yo, you got to listen to the show. Since, for those that don't know, I'm a diabetic. I have diabetes. And, you were doing that show, which was so phenomenal. And I said, Doc, let's do that anyway, because everybody, if you don't know about Real Talk Chronicles, it's not scripted. Doc and I may say, well, what are we going to talk about? I say, well, what you feeling I'm talking about? And you might say, well, what you want to talk about? And then we just go from there. With that being said, I was listening to her show, and some of the things that she was conversing about with her guests was just had me sitting back in my seat like, wow. So, Doc, just enlighten the listening audience, and then I know you might want to talk about something else until we pick up Freddie, but
Right.
enlighten us about what you all were talking about in lieu of diabetes, please. So I'll just sit back and listen, and everybody pay attention.
So, I know in growing up, even before I became a physician, you're sitting around, you have your families, they're playing cards, they're having a good time. And then they begin to talk about they got what they have, arthritis, and they got sugar, and they got this, and somebody's toe was amputated, and somebody, had a heart attack, and somebody's on dialysis. Like it was just a regular way of life. So I'm
Yeah.
listening and I'm hearing, and it runs in the family. You hear them run, diabetes. Yeah, that he got sugar. So
Mm-hmm.
initially, even before I was a physician, I'm like, whoa, people getting their toe cut off, their leg cut off. They don't have circulation, they can't heal. This is some bad stuff. And
Right, right.
you'll hear about folks saying, well, if you do this or eat better. So anyway, having said all that, and let's just fast forward. I became a physician, and yes, I saw a lot of diabetes right here in Washington D.C. at Howard University. But then I began to say, okay, because in medicine, what we tend to do, no offense, doctors out there, but what we tend to do is treat the disease. Okay, we are what we call a disease responding uh, practice of doctors over the decades instead of educating and preventive. Now, I am a physician. I'm not a naturopath. I did medical school and all of that. But I will say this, that with knowing what I know now, 40 years later, out of med school, actually 44 years later, I wish I'd known. And I
Mm.
want to make sure that people understand it's all about understanding what's going on with your body. You know, it's accepting the diagnosis, but you're not diabetes. Diabetes doesn't have you. You may have it, but you need to know. And I'll say this: adult set diabetes, you can reverse that. You can reverse that. Now there's something called juvenile diabetes that your pancreas just not working. But I'm talking about something very different than that.
Mhm.
So with that, I want to make sure that people understand what's going on. It's not about eating sugar. It's about eating carbs. It's about knowing that your body breaks down all what you eat, especially the bready things. All what you eat, it breaks down into sugar. So that means
Mhm.
even the biscuits, the pastas, the different things as such breaks down, and then your body often can't handle it. Now, what is that? When I say it can't handle it, what are we talking about? I'm talking about your pancreas and your digestion. So you overloaded it. Sorry, guys, if I'm blinkering off. You overloaded your pancreas to the point where it's like it's backed up. If you think of a sink and you tried to get the garbage disposal, etc., but it's just backed up. Well, that's what's happening when we say you begin to have insulin resistant or your body can't handle the glucose because your pancreas is where the insulin comes out, but it's not enough insulin to come out. And even the insulin that you are still hopefully producing is not enough. It's like it's just not enough. Your body has all these other things that it's attacking your body. If you think of the Ukraine and the Russian, the
Right, right,
tanks
right, right.
the tanks are coming at you, and you might just have a slingshot, or you might have a few things to knock them down, but they still coming. And you got to make sure that you arm your body with things. One of it is closing your mouth to foods that are not good for you. All right,
Hmm.
you got to
Hmm.
arm your body with a little bit of, and I hate to say it like this, but common sense. And common sense meaning you don't need 5 slices of pizza or 3 slices of the pie. And eat your fruits and vegetables. I know that's a cliche. People are like, but you must eat your fruits and vegetables because what it begins to do is help and really help. So what Billy, my cousin, is telling me to talk about is if you think physiological, so I'm going to take you all on. I'm going to break it down. I'm going to take you on a little bit of a lesson plan
Hmm.
in medicine. If you think about your body vessels, okay, just like I'm on this highway, except the blood is going through and it has sugar in it. It has too much sugar, your
Hmm.
glucose level, and it's going through your kidneys. It's going through your bladder. I mean, your lungs, your heart. And when it's doing that and it's loaded with glucose, it's syrupy. I mean, you like, I call you a sugar baby. Your level of glucose is dangerous. So it's not supposed to be that high. And when it's that high, it's irritating the walls of several things, including your coronaries. Now, that's a big word. Coronaries are the vessels, the blood vessels that supply the heart. And what my cousin is asking me to tell you about that people don't understand and don't recognize is diabetes is one of the main causes of a heart attack. Okay? Because what it's beginning to do is beginning to back up the blood vessels that supply your heart. And then what ends up happening, your heart is on overload. And as your heart is on overload, it's working harder. And some people will say they have something called cardiomegaly where the heart got bigger. And big is not good
Mm-hmm.
when it comes to the heart. The heart should be a tight muscle. It's a muscle. But when it gets big, it gets floppy. And it just kind of, okie dokie, and it's not working as well. So it can't contract.
Right,
It
right.
can't. So that means you'll have people who will have what we call a rapid heartbeat. So you should not have a heartbeat over 100, but many people do. Ideally, it's 72 beats a minute. We don't even think about it. It comes automatic, 72 beats a minute. But some people will say, I feel my heart beating fast. So guess what that means? Your heart has to work a little harder to do the job that someone who's healthy heart does. So understand this. There's something called high blood pressure that we know also is a cause of heart attacks. But there's also something called diabetes, which definitely causes heart attacks because it also attacks not only the vessels, your heart, your veins, the vessels that supply your heart, but your arteries and your veins. It also affects something that's very important, and that's your kidneys. And that's why when people would talk about diabetes, they'll say they're in kidney failure or their kidneys are not working right. And, they end up beginning to register for the kidney daycare. In other words, the dialysis. And they go there twice a week, sometimes 3 times a week to get their blood filtered into a machine. Okay, let me tell you what dialysis is. I mean, you're comfortable, you have a nice little chair, but dialysis is actually an artificial machine that does the job that your kidneys no longer do. All right. So there's so many days you can't go without dialysis if you're in kidney failure. So that's why people will say, even when they travel, they have to find out where the closest place, like if they're on a vacation, and then they register for that dialysis because if they're gone more than a week, they have to check in because
Wow. I didn't know
they
that.
and
Okay.
they get puffy and uremic and kidney failure and they swell up and all of that. So diabetes can cause that. I know I'm trying not to be doom and gloom, guys, but anybody who knows anybody who has diabetes and they've had it for 2 or 3 decades, you'll hear them talking about their kidneys. You'll hear them talking about high blood pressure because once your kidneys are leaving your system or not functioning, then your high blood pressure, your blood pressure will go up as well. Not to mention your vision. So going back to glucose, most most of the diabetics, half of the diabetics don't know they're diabetic until something happens. Either they can't see, they get weak, they're PPing a lot, they're eating a lot, they're losing weight. It's funny. You could have a go into what we call a high diabetic episode. We call it DNKA, and your sugar may be 500. It should not be over 150, but it could be 500. And then what ends up happening, everything is on a weak leg. Your brain, your vision. So you'll hear people say, "I couldn't see." You know, for the first thing, I couldn't see because that sugary. Think of Kool-Aid with extra sugar, and that sugar in your blood is aggravating everything, including your optic nerve, your vision, your eyes. So you can't see. Um, and it's funny. The vision will eventually come back about 3 weeks, 2 to 3 weeks after your glucose is stabilized. So that kind of, it's almost like it takes a minute and it takes a little longer for your glucose to stabilize. So, so please respect diabetes. Please respect your kidneys. Please respect what you're eating, and please respect your DNA.
So
You
let me
know.
ask you a question, Doc. First and foremost, thank you for that enlightening because, like I said, full transparency for those that are listening. I'm a diabetic. I mean, I think a lot of us, as we get older, we kind of don't talk about our health, and we need to talk about it because somebody might be going through something that you're going through something very similar, and you need to converse about that. I mean, we can always talk about what TV show or what happened this and what happened that. As we get older, our conversation should change. So, with that being said, everybody, this is Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Dr. Marilyn Corder, and we got Ingram Taxes in the building. I see you, Jacob. Shout out to Ingram Taxes in the building. If you need your taxes done, no taxes are too small or too big. Let me just read some comments for you, Doc, real quick.
Okay.
Shout out to our cousin Marquita's in the building. What's up, cuz?
Hey,
Um,
Craig.
Stefania has said, she said, I was almost pre-diabetic. My doc told me to ease up on the white bread, white sugar, white uh, white rice, etc. And then Tracy said, diabetes is what I have. It's not who I am. And yes, doctor, it's about learning about what your body is doing and the best way to handle it. Absolutely. Stefania said, once I did that, my numbers went down, and she told me to continue doing so. So, Stefania, are you still pre-diabetic? I'm assuming that is that which where you are now. Uh, Shout out to my girl Taylor. She just had carpal tunnel surgery on her wrist, so I just sending her some love. I don't expect you to be typing in that fast. you know, Stefania says, so why? So now, so now I do eat wheat bread or sweet potatoes. Complex carbs are what we should eat, not simple carbs. Michelle said, hello, doctor. I think you're deviating off this. I don't know. Let me see. She said, hey, doctor. Hello, Dr. Quarter. Now that it seems that the numbers are starting an incline, should consideration of next booster come into mind, or is it too soon? My husband has diabetes, high blood pressure, and recent defibrillator implanted. His last booster was in October. I'll let you answer that. I'll read it again if you need me to.
Ah, your mayor, the mayor of New York, got COVID.
Right.
Guess what? Our mayor did too.
Wow. Yeah, I think they was all at these caucuses and things of that magnitude. So yeah, so Michelle says, she says, hello, Dr. Corder. Now that it seems that the numbers are starting to an incline, sh- should considerations of next booster come into mind, or is it too soon? My husband has diabetes,
Mhm.
high blood pressure, and recent defibrillator implanted.
So
He
his health is compromised. We call it those more at risk because I'm hearing diabetes and I'm hearing cardiovascular because of the defibrillator. So, and it's been since October. So we're talking 6 months out from the booster. You know, I'm going to take a side first and say, I know we're tired of vaccinating. We're tired of, you know, booster one, booster two, booster three. But, however, it's all about getting your immune system ready. And even though the BA2, or whatever the variant, there's so many different variants. We were just talking about it 2 weeks ago, 3 weeks ago, of this newest variant coming from Asia. And there is cross immunity from the first, second, and third booster for vaccine, but it wears off. So just like other vaccinations, after a while, it does wear off. You do have that initial protection. If you've had COVID, you may have some protection. Hopefully, you don't have long haul COVID. But going back to that question, yes, I would say it's time for him to get vaccinated. Of course, I want him to check with his physician, his primary care doctor, because that's going to be important. Because you want to make sure, even though you're getting vaccinated, to get checked first to find out where your health status is, to make sure you're negative for COVID, as well as stable enough to get the vaccine. So I know that kind of says a lot because it's like, well, the vaccine's supposed to help you, but you want to make sure that nothing is going on in what we call an acute phase of your condition. All right. Like, for example, if you have a glucose of 500 and just came out the hospital and trying to stabilize your insulin, your level, you don't need to get vaccinated that week. So you want to make sure that you are primed for the vaccination. But yes, he's due for a booster. Hopefully that shed some light on your question.
Yeah. She says, okay, thank you, and will do. Stefania also said, wow, diabetes is tied into so many things. Yes, it is. Marquita says, weight don't have anything to do with having diabetes. It's generic. Is that true?
So, it's interesting. Yes. So we assume somebody's overweight and their abdominal girth is, wide, etc. And that increases your risk factors. Having said that, your risk factors of hypertension as well as diabetes.
Right.
But you could be a lean person. So don't, miss out and say, well, I don't have diabetes because my body fat is very little. You could. And genetically you could, as well as all depends on what's going on with your pancreas. Now we
Right.
know that when you abuse your body and gain 20, 30, 40 pounds. But sometimes after just losing 20 pounds, I don't know if it was Stefania. Hey, Stefania, by the way. But if you lose some weight, sometimes as that pre-diabetes creeps up on you, and there's something called a hemoglobin A1C, please make sure you know your numbers. Not just your glucose, random glucose. When I say you can get your glucose checked 3 times a day, but your hemoglobin A1C is a special test. It's like your report card. And I
Right.
say that
Right.
because
We can't hear you, Doc.
for the past 3
We got
months.
you. We got you.
Can
Yeah.
you hear me?
Yeah, we
Okay.
got you now. We got
For
you.
the past 3 months, I'm on call, so some of my calls would come through. Sorry. So the hemoglobin A1C tells a story. And I know years ago when I was in medical school, we were doing the diabetic clinic because you go through all the different rotations. I'll never forget how I would see the patients before they come in the room with us with a little pad, and they would write down. They'd be lying. They'd be writing down their glucose, And so that was before we had the glucometers that you could look back, and certainly that was before hemoglobin A1C.
Right.
So it's like I'm gonna tell the doctor lied, the glucose was fine, and we know it wasn't because we're looking at their vision, we're looking at their heart, we're looking at their kidney function. But now it's one of those no-brainers. You don't have to sit there and lie because your blood work would tell us the whole
Yeah.
and or nothing but the truth, the whole truth, as well as, and we need to know that, as well as with your glucometers, which are special. Now we have the ones that you can date back and see what the glucose been. And don't be trying to get your glucose from your child. Say you take this one. All right.
Yeah. Yeah. You take it.
Yeah, that's right. That's right. That doctor gonna get me. But all jokes aside, be real, be truthful to yourself because you owe it to yourself to stay healthy.
And it's so funny because I'm glad Marquita asked that because I mean I know one thing, cancer runs in our family, but diabetes. My mother had diabetes, and that's what she passed away with.
Mm-hmm.
So I say all that to say I didn't claim diabetes for a long time, and I was pre-diabetic until the pandemic. And because of the lack of exercise, like everybody, I think Marquita and Stefania said, I didn't do anything, because everything was droplets out here and this and the COVID. If somebody look at you, you catch COVID and shit. And so it was just like, let me just stay my ass in the house. And then, you just shut it down. And like I said, the metabolism wasn't burning. And so then when I went back, after I went to see him, next thing you know, it was like, well, you're diabetic now, because the numbers just started rising. And that's when he put me on the Geminet. And with that being said, I see you, Gene. Gene is diabetic too. We talk about our numbers and stuff. So I hope a lot of people with diabetes, like you said, Tracy, year one, and there's nothing to be ashamed of.
Right.
I'd rather have these conversations because the one thing that people don't understand is, like you said, it seems like diabetes is a door and it has all these different umbrellas that you can go to. Like you said, high blood pressure, the eyes, the kidneys. So now for the layman person, and slow it down. So when you get diagnosed, and like you said, with the hemoglobin, because my doctor has me do that periodically, he'll be like, and you had just told me that recently, go give me your numbers.
Right.
With that being said, so it starts off with the numbers, diabetic, pre-diabetic, becoming diabetes. I really forgot what started, I think, because I really didn't feel anything, but I realized, so then the doctors, they do the eye check. Then you mentioned urine, because a lot of times, like, urinating a lot, like you said, is that just out the course of the day, or just periodically, or is that because at night I just thought, because I was old, I had to get up and go to bed.
Well, and it's multifactorial in terms of why you urinate a lot.
Yeah.
But what what happens with diabetes? Think about it. Your body has too much glucose, too much sugar. So the
Right,
tendency is to do what? Drink,
right,
hydrate, because it's too sugary. All right.
right.
It's like that Kool-Aid is too sugary. You add water. Your
Hmm.
body is trying to equilibrate. It's trying to balance. So your body's like, get some water, you know, and as you're drinking the water, what's also you're urinating a lot. Plus, as you're urinating a lot, which is a good thing, you're flushing your kidneys, but you can begin to see the sugar in your kidneys. One quick, I call it the poor man test. One quick way that we pick up diabetes, even in children, even in teenagers, I tell them, go down the hall, give them a cup, put their little name on it, and bring your urine back. And I do a dipstick. And the
Hmm.
glucose, no, it's like little squares. You check chemistries,
Right, right,
protein, ketones, etc. And instead of having the same color on the dipstick, it turns green, and that means they have sugar. That even before I get the blood work back, because it takes a day or two. Not only am I doing a random glucose, but I'm doing a hemoglobin A1C. Okay.
mm,
And that in and of itself, you'd be surprised. Let me also say, as you said, break it down. So if you get diagnosed as a pre-diabetic, okay, hopefully not a diabetic yet, but a
right.
pre-diabetic, then you could turn that around. You can begin to do better, exercise, do better, watch what you eat. Sometimes we put you on metformin, sometimes we put you on Captivita. There's some natural things that we also talked about in the show, but you want to make a difference, and sometimes 10 pounds less, 10 to 20 pounds has turned a large percentage of folks who were pre-diabetic. And let me tell you what that number is. So the ideal hemoglobin A1C number is 5.6 up to 5.9 or 6.0. Now that's not your anemia level, that's your hemoglobin A1C. But once you get in the sixes, 6.1, 6.2, then you're becoming already pre-diabetic. And then
Right.
some people will say when you're 6.5, you're diabetic, certainly when you're 7. So again, you don't get the hemoglobin A1C done every month. You get it done every 3 months. But once you have a diagnosis of pre-diabetic or even diabetic, then you need to make a point to yourself, to your loved ones, to say, I'm going to make a difference. The doctor wrote metformin. I'm not going to say don't take it, because you still should take it. But
Right.
then you want to begin to decrease your need and necessity to take it the next time you see the doctor. So you can turn it around. Most of the time, when we get in our 40s or 50s, everything slows down in terms of function. And one
Mm,
of it is how you digest, how your body handles what you're putting in. Most of the time, we're not so busy, active, we're more sedimentary, and then our bodies sort of take a break from digestion as well,
mhm,
digesting like it should, as well as the pancreas. So the pancreas, we're not talking your liver, we're not talking your spleen, we're not talking your kidneys. There's a function. The pancreas makes insulin. Insulin breaks down glucose. Most people don't even know they have a pancreas or don't know what that's about. But there's something called beta cells, BETA, beta cells in your pancreas. And as your pancreas ages, um, and you're overloading, it's almost like your pancreas getting less function, and then you're eating more stuff and junk, and you're getting older. So it's a perfect storm.
mm.
And
Wow.
don't be black, look, and be black in middle age and fat. Okay, so it's the perfect storm. So
That culmination is a killer, right? Yeah. So this is Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Dr. Marilyn Corder. And the show is sponsored by Reggie Wells Quality Speakers. It's also sponsored by the Daily Arts Magazine. And of course, Soft Illusions Art Gallery. Doc, let me ask you a question. So I want to read some comments. I see you, Colin. I got some stuff I want to read. And I see you, Vera, with the wonderful last name, Forster. She's not kin to us, but I love her last name though. I ain't mad at it. Let me ask you a question, and then I want to read some comments after you answer the question. So why is it that when they say for diabetics, like if they going into a little shock or whatever they happen, they eating, they got give them some chocolate, give them some candy. So can you explain that after I read, and then I'll read some
Okay.
comments. Mm-hmm.
Okay. Ask the question again. When they go into shock,
Well, like a lot of times if a diabetic, you hear the old cliche, and even though you'd be like, well, my sugar's low, give me some candy. So like explain that reason, because sometimes I may just see some chocolate and I might just want to eat it. Malika be like, knock it off. You got a sweet tooth. But no, sometimes a lot of people, I've tend lately to make sure that I've always have candy around just in case.
Okay,
I have poor eating habits. So go ahead.
Okay. So some people who are diabetic feel, well, I'm gonna fix my diabetes and I'm not gonna eat. Meantime, they're taking their shots, they're taking their insulin, they're taking their metformin or what have you. But if you're a diabetic, you are obligated to yourself to monitor what your glucose is, because there's something called hyperglycemic and there's something called hypoglycemic. And I say hypo, meaning that your glucose is too low. And if your glucose is too low, you could die. Mm-hmm. You might feel dizzy, lightheaded, weak, and you go into a coma, and it's too low. And this is why, now pay attention. So if you're trying to improve your glucose levels, which is you should, you need to continue to make sure that as you're taking your medication, let's say it's super high, the medication, because you've just been hard-headed and eating everything, and then you decide because you tuned into Real Talk Chronicles and you saw my cuz trying to get you ready for a better life and health. Absolutely. And then you start doing the right thing. But then you have all these different levels of insulin you're supposed to take. So pay attention. You then need to make sure that if ever there's a time that you're monitoring your sugar, because there are going to be times if you're on what we call the sliding scale of your levels of your insulin level, you need to recognize that you may not need all that insulin, that little bottle, that $600 bottle that we've been talking about. You may not need all that insulin at that time, because you take what you would usually take when you're just eating crazy and your glucose is 300. But let's say your glucose is now 100, but you still taking as if it's 300 and you go to sleep, you may not wake up. Just as bad as hyperglycemic high, so is hypo. And you know what's interesting, and I'm going to just put this out here. There's some people who are having what we call gestational diabetes. Big word, meaning when they were pregnant, they quote unquote developed diabetes. We now have found that those women who are gestational diabetic, rather, and they're young, they're childbearing age, let's say they're 20, 30, and they have a big baby. Okay. Now follow this. And the OBGYN would begin to test them, and they have what we call a glucose challenge test. So glucose tolerance, we call it a GTT, glucose tolerance. So they have to drink this syrup, and then every so many hours, 2 hours, 4 hours, they draw their blood to see how they're handling the sugar. Because when you're pregnant, you eat a whole lot of stuff. So I would, as chair of the nursery here in DC, this hospital, the hospital I love, I ran the nursery. So I would get a call, and they would say, we have a diabetic mother coming in, gestational diabetic, and we would have to put our guards up, because a diabetic baby born to a diabetic mother has issues. They're big, 9 pounds, but they have issues. Their heart can stop. Their glucose drops. And anybody out there, if you know yourself have had it, or your grandchild, the doctors we will put that baby in the ICU, in the intensive care. We call it the NICU, neonatal ICU, because that baby sometimes may need an IV to get the glucose up. Because we do the little heel stick. We do the little heel stick and see what the level is. It needs to be at least 50. If it's 30 or getting low, we'll tell the mother, I know you want to breastfeed, but we got to start feeding the baby by mouth first to get the glucose up. Because so that's called gestational diabetes. Now, fast track, a mother who was diagnosed as gestational diabetic during that childbearing age, they're now saying is prone, and more prone, no matter what size she is, more prone to be a pre-diabetic and a diabetic in her 40s and 50s.
Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder, breaking it down, having real talk with you. I'm your host, Bill Forster, with my co-host, Dr. Corder, and she's talking about diabetes. And let's keep it real. Diabetes is no joke. First and foremost, it is a monster. Let me just read some comments too. Colin also said, he said, education and more education is what is needed, RE, diabetes, and dialysis. Um, Marquita also said, and how you eat, definitely. Michelle, Michelle said, he almost died because he had a bone infection which didn't heal properly, which led to a partial amputation of 2 toes. He has retina detachment and is now partially blind, all developed because of diabetes. His problem was that he was in denial and hated doctors. Wow. And you know what's so funny? I never forget when they always say you can go into a doctor's office and next thing you know, they talking about amputating something, a part of your body, which is crazy. Like that happens like instantaneously. You could talk about that. I see you, Earl. Um, let's see. What's up, Cheryl? Cheryl White and Billy. She said the numbers are increasing with the sub variant. We'll get to that too. Stefania said, no, I was almost pre-diabetic. I believe pre-diabetic is 5.7 and up. I was at 5.6. Now I'm at 5.5. She said to aim for 5.2. So I'm still doing the work.
Go ahead, Stefania.
Yeah, she's breaking down the numbers.
A 10-year-old. Yeah, honey. Go
ahead. Yeah.
And let me tell you, we end up allowing. I love it. The regular range is 5.7 and above is pre-diabetic. She's right. But you know what they have said in Black medicine, they're like, okay, we're gonna give it up to 6. But in general, you're right, Stefania. It's 5.7 and above gives you that pre-diabetic. 5.7 to like 6.2. Anything over 6.2, you are diabetic. So I am proud of you for having your glucose, because that's hard. Hemoglobin A1C is hard to do. Going back to one comment, Bill, you have also the circulation, as I said, is poor. So your extremities, your feet, your toes, that's the last thing to get circulation, arteries, etc. So then often people don't even know that their toe is infected because they don't even feel it. They heal slower. A diabetic heals slower. A female diabetic gets yeast. I mean, so they're prone to get different infections. And once that infection gets out of hand, let's say a bed sore or just a foot infection, becomes gangrenous. Gangrenous is when the color is green. First it gets dark and ashen, and then the skin is really dry and black, and next thing you know, it's infected.
Yes.
It doesn't look like it has life. So by all means, that infection is serious, because it will and can, how should I say, it can affect your body to the point you have blood. It can be in your blood, and that infection can go and kill you. So she's right. Whoever said that. And what they do the amputation, because in amputating, it saves your life because it takes away that bad tissue and that bad part of your body that's beginning to infect you. But you're right. Whoever said, I think it was you. Michelle. They want to amputate, but sometimes that's because people ignored. Look at people's feet. Look at your relatives, and just look everywhere. Sometimes they have them shoes or socks on. Look, because that could save. If they catch it before it gets to the point where there's no return, then you can have you can have some life to it with washing it and physical therapy and checking it and debriding it. There are times we have to scrape a little bit of that dead tissue to have good tissue come up. But I've seen some bad stuff.
Wow.
And it's not a pretty look. And we need to talk about it more. We need to address it. We need to, people, there's shame and all, I don't want nobody to look at it, but they need to look at it to see what that skin looks like.
Absolutely. Colin says, I have diabetes. Diabetes doesn't have me. You must take control and know that everyone's body is different. Colin, you are a walking.
That's right.
Because Collins was the one that also talked about the kidney transplant. I think. Remember, cuz when he was talking about.
Oh things? Yes.
Collins, I appreciate you. When we talk, you always upbeat. I've never heard you have a bad day, even if you're tired. You don't sound like it. Let's see what else is. Tracy said, finding the right. Let me say, endocrinologist is wait.
Endocrinologist.
Yeah,
Good
yeah.
point.
I got a fat tongue. I got carried away
It,
with it. Endocrinologist is
it,
key. She said,
that's right.
I worked for three of them in the past, and it was amazing to
Right.
see how they treated their parents. One,
The patients. Oh.
yeah, the patients. Excuse me. Once I one I consider as insulin pusher, and I've seen some people. Let me see.
I like this
PT.
comment.
Yeah, yeah. Okay, let me start it from the beginning because
Yeah.
I had it there. She said finding the right endocrinologist is
Right.
key.
Endocrinologist. It is key. And
Yeah, I'll
she's
let you
right.
work that word. Exactly.
Right.
He said, I worked for three. I worked for three of them in the past, and it was amazing to see how they treated their patients. One, I consider an insulin a pusher, and
Uh-huh.
I've seen some PTs on up to 7.7 to 8 different medications.
Yep.
But there is one who works with his patients to educate them and encourage them to take accountability regarding what you're eating and how it affects your body. Wow.
Wow.
He said,
Yeah.
you want to comment
So
on that? I'll let you rock with that,
okay.
Yeah,
Okay.
yeah.
So hold on. I'm trying to find out the airline. Hold on.
Okay. Yeah.
Okay.
I'll go some public service announcements while you do that.
Right.
Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Dr. Marilyn Corder. And we're talking diabetes. Right now, Real Talk is sponsored by the Daily Arts Magazine. It's sponsored by Leon Ellis Chocolat Restaurant on 120th and Frederick Douglass. Please go in there and mention Real Talk Chronicles. It's also sponsored by Melba's, 2 restaurants. Melba's Soul Food, a restaurant on 114th and Frederick Douglass. For those that don't know, I'm doing a brunch party. I know, even with the pandemic, we're doing a brunch party next Saturday. It's going to be on and popping. So please, for the grown and sexy. Taylor also says, she says, you want to read? You want to comment on Tracy's?
Yes.
Go
Yes.
ahead, please.
Okay. So the endocrinologist, I tell you what, she's right. Let me just put my seatbelt on. I'm moving now. She's
Okay.
so right because I always say this. Yeah, you can have diabetes, but you got to educate folks. Just because you have diabetes, again, I emphasize, and maybe that's the pediatrics in me, or maybe that's just the Black sisterhood in me.
There you
It's
go.
important to educate your patients. And, knowledge is power, and we need to empower. People don't understand. And they say, oh, I got diabetes, and that's it. I'm going to die from diabetes. No, no, no. You can reverse that. You weren't born with diabetes. You can reverse that. And a couple of your callers have said, I have diabetes, but diabetes doesn't have me. And that's so right. So let's work it and do it and get those organs and get those blood vessels to the point where they are, improving and functioning better. It's like we take our cars to the shop to get fine-tuned oil change, etc. Let's do our bodies the same thing. Let's do our bodies the same way. An emission test. Let's make sure that our hemoglobin A1C is working, our pancreas is working, our kidneys are working, our liver is working, drinking your water, and to me, that's so very important. And we need to do that. We need to take charge. There's some people in denial. It's not a pretty thing for somebody to say, I have diabetes. I'm getting sick. Things I used to do, I can no longer do. I understand. But don't let it get any worse, because it can get worse, and it will get worse. And we know what the final worst is: death. So you want to begin to improve your quality of life as well as your longevity of life. You can. You really can. And I'm going to say, I'm not all that medicine pushing, but sometimes you do have to be on medicine until you get it right. I'll just say, for those people who are interested in helping your diabetes while you're still working with your doctor, get that information to Bill of Real Talk, because I can give you some information and kind of help you through. But you have to make sure you're checking your glucose. You have to make sure that you're doing what you're supposed to do and get some of that weight off. 10 pounds really can make a difference.
Yeah. Taylor she says, people, please take care of your health. My sister was diabetic. In 2017, she went into kidney failure and had to go on dialysis. Her vision was failing. She also had MS, and she suffered from poor circulation in her legs. She passed away last year, January. My condolences. We have a history of diabetes on both sides of the family. Unlike a grandparents, most of us, unlike our grandparents, most of us have health insurance. Please use it and be proactive. Exactly.
Good
Marquita
for her.
yeah. Hypertension runs in our family too. You're right. Definitely it does, Marquita.
Mm-hmm.
Colin said, Doc, why does some anti-rejection meds increase your glucose numbers?
Because they're steroids. Let me tell you. So, anti-rejection meds. Hold on, guys.
Mhm.
Anti-rejection medications are like steroids. When I say so, it cuts down on your, oh, how should I say, on your natural, on your natural um, defense. Okay, and so it, and in doing that, your body sees that as fake. So your body makes elevated sugar, glucose. Like your body says, "Uh oh, I need to help out because this anti-rejection medicine is putting my body in a little bit of a shock, even though the anti-rejection medicine is necessary so you won't blow that transplant, be it a kidney or what have you. But
Mhm.
it's like a double-edged sword. We have to put you on the anti-rejection so you won't reject it because your kidneys, the new kidney needs to stay functioning. But unfortunately, the anti-rejection medicine keeps your immune system at a weaker level as well.
Wow.
So
And then he finishes off. He says, my diabetes were very much under control
yeah,
pre-transplant, but now it's all over the place,
I
taking
know.
insulin 4 times daily. However, I'm doing great.
Oh, bless his heart. He's alive, you
Yeah,
know, and it's
absolutely.
all relative. He's alive. So,
Yeah.
yep, yep.
Vera, Vera Foster with the wonderful last name. I always got to shout you out, Vera. You know that. He says you also have to check your feet. It affects your circulation.
That's right.
Also have to watch out for injuries. Yeah, and so
Because you
funny.
don't know. Matter of fact, let me tell you about the injuries. You can knock, you can walk around the house and knock your foot on a chair or table edge, and you don't even know. And you look at you, and you got to check the skin, check your circulation, check your feet, because you may not even realize the trauma that you have on your body. And, phew, and then you go to the doctor and it's like, whoa, Miss Jones, how long has that been looking like that? You're like, what?
Right,
And Miss Jones is in trouble.
right. And full transparency, I had stumped my toe in the house, probably broke it, and
Mm-hmm.
Doc was like, "Yo, if let me know if you need me to look at it. Send me a picture of it." I
Yeah.
didn't, but
Yeah.
it was just broke. I mean, that's the old martial
Mm-hmm.
arts basketball,
Mm-hmm.
old school
Mm-hmm.
guy. You'd be like, "Yeah, I'll deal with the pain." Uh, Tracy said, "Doc, your opinion on using Dexicon? Is that what it's? Am I saying
Mm-hmm.
that?" She said, "What's your opinion on it?" That's from Tracy.
Um, well, let me just say, when you on all medications, not just the Dexicon, the thing you want to do is know all your side effects. One thing we don't do in medicine enough, we write prescriptions for things that we need to write prescriptions for, but we also need to educate that patient and to say, Miss Jones, we're going to put you on this, we're going to put you on that, just like the rejection medicine. But this is what it's also going to do. So look out for those, because then you end up having someone having side effects of this medicine and that medicine. And then you give them medicine for that side effect. It's like, okay, wait a minute. And they're on 6 or 7 medications when that medicine that caused the heartburn or that medicine that
Mhm.
caused the dizziness or medicine that caused fatigue, you can begin to taper or adjust so that you're not taking medicine for side effects of the previous medicine. So
Right.
and that's why people need to educate more, and you need to, and even if your doctor doesn't, the doctors are burnt out. They may not remember to tell you, but that's your responsibility to check it out and do your due diligence and read, a little white bag that the pharmacist has, and it has a paper on, on the front. And most time they just tear the paper off and throw it in the
Yes,
trash.
yes,
Open
yes,
that paper
yes,
up.
yes.
It's often stapled, etc. Open that paper up and look and
Read
see
it.
what that paper is saying in terms of what to look out for. Even to the point, there's some medicines that will say you can't take grapefruit juice.
Wow.
Drink it. Drink grapefruit juice when you're on it. Not to mention alcohol beverage. So you need
Yeah.
to really understand, and hopefully you're not on a lot of medicine, but if you are on one medicine, you need to know what the side effects are, because that medication is helping you for whatever that disease or diagnosis is, but that medication also is going to bring a new set of possible side effects.
Hmm. Wow, everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder, and I'm the co-host on this show. When it's her, I'm Bill Forster, and this is sponsored by Reggie Wells Quality Sound Speakers. You can get them for $85. But if Reggie, if you mention Real Talk Chronicles to Reggie, he'll give them to you for $75. Lynn Lett said, "Hey, Bill, I am so glad you are having this conversation because I find people of color do not talk about it, and this is so awesome. Thank you." Rendrick Arthur, what's up, X? He says, "Thank you for your knowledge, Doc." Curtis Oliver said the 3 Ps. I don't know what the 3 Ps is. There the 3 Ps? Something in reference to diabetes.
Wait a minute. You're going in. Hold on. You're going in and out. Hold on.
All right.
Okay. And my children's flight is delayed. Okay.
Oh, well, I guess you can stay with us a little longer unless you want to go and do something after a certain time. Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster. That's Dr. Marilyn Corder. This is Real Talk with the Doctor. Please, if you like it, subscribe to it. If you're watching it on YouTube, if you're watching it on Facebook, share it. Share this knowledge. Information is key, and a lot of us don't do that. I'm sure the doctor will be back in a few minutes. Yes, this show is sponsored by Ingram Taxes. There isn't any taxes too big or small that they won't do. This is sponsored by the Soft Illusions Art Gallery. Like I said, I'm doing a brunch party next week, April 16th at Row House. If you're not doing anything, just come on by. Even if you want to make reservations, make reservations. I don't know if they have any, but make reservations. You can come by. We do either from 1 to 8. Wear what you want. We're grown. You don't have to get, wear some sweats if you feel like it. Definitely wear some jeans. Don't get too cute. You sit down there because after you eat, stomach start expanding. You know what I'm saying? So the show is also sponsored by the Daily Arts of Survival magazine. It's on Amazon. It's #1 magazine in martial arts. And we have the doctor back. Good.
I'm back.
Good. There she's back. So I was asking you, Curtis Oliver said the 3 Ps. Is that something in regards to diabetes? And Curtis, if it is, I don't know. Hit me up and let me know what the 3 Ps are. What's up, Sharon Saunders? I see you. Tracy Morton said, "Teach, Doc, educate." Taylor said, "I appreciate this forum bringing awareness." Absolutely. Sharon Saunders said, "I had lunch with a friend today who was recently diagnosed with diabetes. She said she became diabetic after the birth of her first child, who was 2 years old." Yeah, you mentioned that earlier too, Doc. Yeah, Sharon, you might have to backtrack on that. And the doc definitely broke it down and educated. I don't know if you heard it too. Oliver said once they start cutting them, they don't stop. I hope not. Exactly. Stefania said, "Hello, I'm trying, Dr. Corder." She said, "Day by day, I'm trying, y'all." Colin says, "Some of us don't listen to the medical doctors. We tend to listen to our friends who got their medical degree from Facebook." Absolutely.
Dr. Google. Dr. Google. Yeah.
What's up, Princella? How are you? Michelle said the infection got into his bone, so they had to because once in the bone, the infection spreads quicker.
That's right.
We were told. So Sophia says, "I did add cinnamon pills to my list of vitamins because I read that it works for sugar control, etc." What's your take on that, Dr. Corder?
Okay, now tell me what she said. I'm trying to show y'all the DC again.
Okay, yeah. Doctor sightseeing. Go ahead. Show us some sightseeing seeing right now, real quick, and then we'll come back to that question.
Okay, so there's the monument. And there's
right.
the Lincoln Memorial. I don't know if y'all can see it or not.
Look at that. It's still nice there too, right? How was the weather there?
It's still nice.
It's still beautiful.
All right. So it's the diabetes. Okay, so the question, what was the comment was? Well, one is when they start cutting, they keep cutting. Well, sometimes they do, because that circulation or that poor vessels continues to be poor vessels. All right. Then there was another.
And then Stefania said,
the diabetes. I'm sorry.
Yes, Stefania said, "I did add cinnamon pills to my list of vitamins because I read that it works for sugar control, etc."
It sure does. Stefania, you know what? Let me tell you, your listeners, they're on it. Okay. And they text me and email me, etc. And they're on it. cinnamon, you can put cinnamon in your coffee. Cinnamon also helps diabetes. It helps break down glucose, and it also helps. Cinnamon also helps sugar, diabetes, and hypertension. Okay, so
Yo,
anyway,
Doc, yo, watch this. Malika, let's get us some cinnamon.
yes, yes.
Yeah, okay. So let's see. Curtis said yes, they have to have a circulation test often. She says Curtis said I lost 50 pounds due to diabetes and still monitoring. I have no left toes. Oh wow.
Yeah, yeah,
Ollie, I didn't know that, bro.
yeah,
Wow.
yeah. And you know, it's interesting. A lot of people, you know, they got to get fitted for special shoes, but a lot of folks, you know, they've lost their limbs and their toes. Of course, they have shoes on. You don't know, but it's something that we need to talk about more instead of being shameful, because you know people are like, well, they're not going to accept me because I don't have my limbs. Yeah, they will. As a matter of fact, not only will they accept you even more, they will help you make sure that that's the only thing that you lost. We got to make sure that we, you know, take you to the doctors, the buddy system. Okay.
Right. Tracy Morton said, and Gordon, I'll say the whole name. Sorry, Trace. She said, stay hydrated, and there is zero Gatorade. Now that has zero sugar, and it actually tastes good. Kiwi strawberry, delicious. So zero Gatorade. Okay, I'm gonna have to look at that too. Sometimes, especially for the working out aspect.
Well, be careful, and I'm glad we're talking about Gatorade. Be careful. That zero Gatorade is no sugar, but that sodium overload. All right, be careful. So that
Okay.
zero is without the sugar, but check your sodium on that, please. All right.
And Reggie, I know Reggie, you're on here. We was talking about that Gatorade because Reggie was saying that he was drinking Gatorade too. And so now, like I said, I'm sure he probably had to cut that. Now, let me ask you a question. Not to just, I'm just deviating a little bit, but can this cause gout?
You know, anything can cause gout, the circulatory interruption and pain and inflammation. So,
Okay. All right. Good. I'm glad you said that. Okay. Curtis asks, he says, does the hypodermic chamber good for treatment of a toe open injury, Doc?
Yeah. If you can get it, yes. Yes. We have one of those centers here in DC. But if you can register for that, because what it does, it maximally helps your body heal. And the hypodermic, so that's good.
Okay. Michelle Ivory says, Jones, she says, like when you take water pills, you have to keep check on your potassium.
That's right. Yeah. Wow. Because you'll get these, it's like Charlie horses. You'll get tingling because your potassium, even though the water pill is helping your blood pressure. But what did I say earlier? When you have something, one thing aggravates another. So you kind of make sure your potassium, people would say, take about a glass of orange juice or eat a banana to get your potassium up, or even potassium pills. Correct.
Tracy Morton Gordon said that Doxicom, I'm pronouncing it right, is a device to monitor your levels that you wear for 10 days, and your doctor can review it too.
Oh, right? That's okay. Yeah, you know, we have the. I understand what she's saying. We have the levels now that you don't have to do anything. You wear, and it monitors your glucose, which is easier than pricking your finger. Okay, well, of course, your hemoglobin A1C. A lot of the insurances may not pay for that device, which they should. You can fight for it. So that I understand what she's asking. Yes. What do I think about it? I think anything that gives you a better knowledge and your doctor better knowledge of your level of diabetes or what have you, even having your blood pressure cuff at home, things that can tell them what's going on even when you're not in the doctor's office is always a win-win.
Wow. Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder, and I'm Bill Forster. Colin said, my endocrinologist.
Yeah, okay, here we go. Endocrine. Yeah. Just think
endocrine. Yeah, because these words is tearing my tongue up. Now, listen. and he says, my nephrologist.
Nephrologist. Okay, so here we go. So the endocrinologist is a specialty from internal medicine, the endocrinologist takes care of 5 different things that people will hear about. One of it mainly is diabetes, but there's something called your endocrine system, ENDOCRINE. And your endocrine system also includes your thyroid. So you can have somebody with hyperthyroid or hypothyroid. Hyperthyroid is when the Graves' disease, when your eyeballs are popping out and you're moving fast and your heart is beating fast and you're skinny. Now, hypothyroid, think of hypothyroid, is when you're sluggish and you're cold all the time and you're gaining weight. So your endocrinologist takes care of that. They may have you have surgery. You'll see some people with a little line on their neck, or they will do what we call ablation, where radiation blocks out the hyperthyroid, and then they go on synthyroid or medicine that replaces your thyroid hormone. The endocrinologist also, funny enough, also does some things we call reproductive things, because your ovaries, there are certain things in your body that's related from the pituitary on in terms of your reproductive organs. But the main reason for endocrinology, and they do the kidneys. Okay, so that the endocrinologist is a diabetic. Now, when you have an array, hold on, my son is texting me. Hold on, they're stuck in Chicago. That's okay, good. See y'all then at 10. Okay.
10.
Yeah, that's what I'm talking about. I gotta hang out in DC. Well, y'all got me.
So, well, I was just about to ask you how long you want to stay. We ain't gonna stay on the 10, but I guess we got to get.
Well, you may as well.
You got to get another half an hour. I mean, everybody, listen. We got. So Collins also said.
So wait a minute. So I'm sorry. So nephrologist is the big word for the doctor that takes care of your kidneys. Mm-hmm. The nephrons are the little cells in your kidneys. So if you think of, I'm trying to think there's kiwi, there's certain fruit that reminds me of nephrons, with the little circles around and then the big circles around. So anyway, but the kidneys functions is important to know what your function is. And, people will say, well, if the kidney's so important, how come people can give one away? They can. And hopefully you're born with 2 normal kidneys, but you don't know your kidneys are functioning until you get them tested if you're trying to donate a kidney. Or some people don't know what's going on with their kidneys until they start swelling up. And when they start swelling up, that means that the kidneys are not functioning. Wow. Because they, and then we talk about kidney failure. Another word for kidney failure is called renal failure. Or you just can't pee and you're swelling up. And that's where the dialysis appointments, and they put a port, there's a device they put in your body so that connection with that machine is connected. I remember we here in DC, 82? I'm trying to remember. 78, okay. In the late 70s, I was finished med school. And in the 80s, I was doing renal. I was doing internal medicine. Actually, in med school, I was on the kidney team. But we were number one, Dr. Clive Callender, who is still alive. He was in front of the Black Enterprise, etc. Look him up, Clive Callender. As a matter of fact, his brother lives in New York. He has a twin brother who's a lawyer. But Clive Callender, he started the first the kidney transplant at Howard University. So that's a bit of Black history. And I was as a medical student, I was on the team. So we'll have folks waiting by the phone. We didn't have cell phones then. Waiting by the phone if somebody, unfortunately, who died in a car accident or what have you, and they would fly the kidney, on the plane on ice. And I've been in more transplant surgeries than shoes in my closet. Wow. Because I was fortunate to be on what we call the renal team. And it was exciting to see that. And, sadly, it wasn't exciting that people needed the kidney, but it was exciting to see I call it, like, short of God, the miracles and the smartness of the doctors there at Howard that saved lives,
So then he says, my oncologist, my dermatologist, my neurologist, my podiatrist, my ophthalmologist,
there you go.
All the doctors are at the same hospital and communicate with each other.
That brother is on it. So when you are a diabetic, you have to see 5 specialists. Let's start from the top. Ophthalmologist. Remember we said diabetic retinopathy, big word, meaning your eye.
Right.
ophthalmologist. You also have your endocrinologist. You also have your nephrologist, which is your kidney. You have your dermatologist to look at the skin, and you have your, I think he said oncologist. Usually that's cancer, but I
Yeah.
think that. And I think he said one, but all of them are the same. Sometimes it's a cardiologist too,
Yeah.
babe, because that
Yeah.
cardiovascular.
Podiatrist. Yeah. Neurologist.
Oh yeah,
Yeah.
neurologist, because you could have a stroke, high blood pressure, etc.
Yeah.
And so you have the team. Most people are not so fortunate, but you have the team, and you need to be telling them how you're going to get and reverse things and get better. And of course, be thankful that you do have all those specialists with their specialty expertise.
Yo, you know what's so funny? I want you to drop the bombshell that you dropped on your show on them in a minute, and I'll like segue you into it. Taylor, she said, Stefania said, I wish Dr. Corder was in New York. Me too. Nah, but I'm for selfish reasons. You talk for medical
Send me
reasons.
a ticket. I may have to come up in there for like a
Yeah,
week or two.
yeah,
And
yeah.
then
Hang out. Exactly,
open up
exactly.
a corner store and let people come in. I check them out.
Listen, absolutely. Taylor said, be more diligent about checking the side effects of your medication that you are about checking the side effects from members of the opposite sex. Absolutely. LOL. I'm just saying.
I
Yeah,
love
break
it.
it down.
Go
Taylor's
ahead,
my
Taylor.
girl.
Break it
That's my
down.
girl. That's my girl.
That's right.
Reggie Wells said, is apple cider vinegar good to drink?
Yes, it is. If you can tolerate it, yes, it is.
Okay.
Lemon water and apple cider vinegar, very good. It's almost like cleaning out your tube,
System.
your system and your pipes. My son just said they're hungry. But anyway, I got to make sure I have food.
Are they, are they here now?
No.
Oh,
They're going to be hungry. They're going to be some hungry critters getting off that plane.
oh, you know they are. You know, wow, they got pushed back. It's not weather, just a delay.
Right. And I'm just going to say, I got you. Mama got to feed the children.
Oh, absolutely. Yo, listen, it's not like a mama's love, right? Let me tell you something. She can be doctor, but yo, when her boy coming and her daughter,
that's right.
Oh my God, my cousin. Shout out to my cousins. They're doing their thing. Sharon Saunders, she said, my late cousin had poor circulation in one of his legs. He sustained a sore on one of his legs, and it never healed. He died 2 years later of kidney failure.
So, in honor of your late cousin, in honor of those that had gone ahead of us, we have to learn from their experience, and we have to maximize it and bless their hearts. They're telling us and showing us already the map in terms of here, this is going to happen. So let's back up and say, okay, it's in our DNA, and it is. All right, Black folks is hyper blood pressure, diabetes, or both. But you want to begin to say, I hear it, I see it in my family, but I'm going to step back and I'm going to do some things to not allow it to be so aggressive and so present in my life. And there you, like the apple cider vinegar and the cinnamon. I mean, you guys are talking it. Again, I have some things as well that I take. I should have had diabetes. I'm pre-diabetic, but I'm not anymore because I take something called Captivita. I take a few things that doctors are not going to tell you about because we it's interesting. A lot of doctors are on natural herbs, but if they tell their patient will look at them like kind of side eye, like, wait a minute, is this a quack? But we know it works, and we're gonna take it until we have to be on medicine. And even when folks are on medication, we're taking our natural herbs. We're taking it. Better know it. All right.
Yes.
What else you got, Bill?
Okay. Yeah. Sharon said, my late cousin. Oh no. Okay, I read that. Michelle said, I just went through a series of testing because my ankle swelled during high humidity. Now, periodically, my knees would swell, but we, I guess, doctor, thought it was part of my edema.
Edema, right?
Edema. I don't know.
Lymphedema. Okay, so lymphedema is a hereditary
condition. No, let me spell it. Let me say it's a EDEMA.
Yes, edema. Did she say lymphedema?
Michelle, if you meant lymphedema, you didn't put it, so I don't know. But
hold on, edema. Okay, it doesn't have to be lymphedema. Edema is nothing but swelling. And what you want to do, anybody, when you press your ankle or press the top of your feet and that indentation remains, that's edema. That's not a good thing. What you want to find out, number one, is what's going on with your heart in terms of high blood pressure. What's going on with your kidneys? What's going on with both of them? Um, and then what the doctors tend to do is not only put you on medicine for whatever, but they'll put you on fluid pills. I mean, be careful with the fluid pills. You have to take them because that takes the fluid away. But someone already said it takes, your your potassium drops. So you want to make sure that you're not taking 20 or 50 milligrams of potassium pills every day. You may have to take 12.5 or 25 on an alternating day. But follow your doctors. I'm not trying to be in front of your doctor, but I want you to be aware of why and when they put you on things and what to look out for.
Okay, and then let's see what else she says. She says edema. Let me say, okay, ankle swelling, edema. But it relates back to the inflammation in my back, sciatica. She ruled out heart, kidney, liver, and all major issues.
Good.
Okay. Vivian, what's up, Vivian? How are you? She said, "Hey, Bill, thanks, Dr. Corder, for the great information you are providing. It's always, everybody in there. If you're watching, you loving what Dr. Corder is giving you. I mean, I'm gonna take a little bit of credit, but if it wasn't for her giving this knowledge, listen. So, can you put some hearts up there for the doctor?
And look, and this is all free. I ain't asking y'all for no copay or anything. This is all free. Okay, I'm not asking you what insurance you take. You take what I take all y'all's insurance because you know what? The insurance I want you to have is Get Better. It's called From the Heart. That's the insurance I'm taking from the heart.
I tell you something. The doctor does it. She has her village. She'll give that information before she leaves on her village voice. And listen, Real Talk Chronicles. There's nobody else talking this. There is no one out there in the podcast world giving you this kind of information. What? Let's take us number one, y'all. This is what it's all about. Tracy said, I work for a medical group and worked for here we go with that
endocrinologist.
Yeah, there you go. And the neurologists and now intern medicine doctors. So when I review doctors' chart notes on the patients, it's clear that if you don't educate yourself, at most you will maintain, but you won't get better. And that's the goal, is to live a healthier life. And the doctors can't do that for you.
Right. That's right. You got to take charge. And I tell you, I've had folks who, one of us, my husband's aunt, she's out in Colorado. To hear her story, she went to the doctor. She's in her 70s. And she said the doctor did her blood and she had a hemoglobin A1C of 7.2. So what does that mean? She was diabetic and didn't know it. I call it the undercover diabetics. She didn't know it. All right. And so the doctor wrote the prescription for metformin. And she had already heard my husband, the other Dr. Corder. By the way, I'm married to a physician who was my chief resident, but we wasn't dating. It wasn't like Grey's Anatomy, okay? Anyway, so she was 7.2. So he wrote a prescription for metformin. Well, we have something called Captivita, and so she knew that. When I say we, it's some herbal stuff. So I shouldn't say stuff, some herbal good stuff. Anyway, so she went away. And she told Fred, the other Dr. Corder, doctor gave me that metformin. I heard about that causes cancer, because, she reads and we did update told her. So they wanted to see her back in 2 months. And they did. And they drew her blood and they looked at her and they said, I'll just say Miss Jeanette, your levels look wonderful. That metformin is really working. She looked at him and said, no, it ain't. I ain't taking that stuff. You got side effects. She's like, and she's from Mississippi. You got side effects of that. I took my cousin Freddie. I took what he said. And the doctor looked at, he said, well, what you got? So sometimes it's the patient educating the doctor. She is non-diabetic. Her hemoglobin A1C went all the way down. Guess what, Stefania? 5.9.
Oh, watch out now. Yeah.
So the information that I'm telling you guys, if you want more information, because I do have to go, have them hit you up and chat in the chat.
All right, definitely. You ready to make your move? Let me just read this comment and then you can do your thing. Thank you, everybody. That's Dr. Marilyn Corder. Check her out on Village Talk. She's going to give you the information, and that's what I just want to read the comments. You may not be able to answer. Please, everybody, share this information. Where you getting this kind of information? Some of you got doctors and not even getting this kind of information. Like she said, you got to educate yourselves. You know what I'm saying? I can do the best I can, but I need your help. Taylor said, Dr. Corder, it was great to hear you sharing all the vital information. these are the type of conversations Black folks need to be having. Bill, as always, a wonderful segment. Michelle was talking about heat edema. Curtis asked, is castor oil good for diabetes?
Well, castor oil is good for everything. And,
okay.
And let me tell you, anything that will slow down inflammation, that's natural, not Motrin or Advil. Anything that's natural, castor oil, that helps your digestion. That helps leaky gut. That helps a lot of things. So if you could tolerate it, castor oil is good, and the vinegar is good. And they have the tablets. I think it's Gochi, but anyway, they have tablets that is like the vinegar without the icky taste. So, but be aware of your body. Be aware of all that's going on. Have your blood pressure checked at home. Get invest in the cuff that you just press the button, because don't rely on the doctors. We only gonna see you once every 3 or 4 months or every 6 months. Don't rely on us, because we dying on the vine too.
Yeah, Doc, I'm gonna read the comments, and then I want you to talk about Captivita and also where they can hear you on Village Talk. All right, let me just read this real quick. Let's see. Tracy said, don't hesitate to question the doctors regarding your care and the medication that they prescribe, and realize it requires work on your behalf.
Yeah.
And you must educate yourself. That is the key. Taylor said, Dr. Corder, you are Black girl magic and its finest. That's what's up. I appreciate that. Michelle said, thank you, Dr. Corder. Doris Brown, what's up, D? She said, Bill, ask her again, what should you take for a high A1C and cholesterol?
I'm about to tell you.
Yeah, tell her. So hold that thought. Let me just finish reading the questions, because I know where you're going. Tracy Moore, she said, thank you, doctor. The information she is providing is usually under a consultation, which can cost you $400 plus. Absolutely. You're right. And all you got to do is just share Real Talk Chronicles and help me become bigger than I'm supposed to be. And doctor, bring this with us and bring all my panel with me. And Curtis said, thank you again, doctor. What's up, Lena? So go ahead, doc. Tell them about
okay. So well, first I'm gonna tell you, you can hear me. I have my own show, Radio One. That's the largest radio and TV one, Kathy Hughes. So I have a show every Saturday live, DC, from 3 p.m. to 4 p.m. I've been on it like 20 some years. I don't know how long. Look, I do HUR too, which is Howard Station, but I have my own show. It's called Radio One, DC, WOL 1450 AM. Or 95.9 FM. And often I have Mr. Bill Foster on it, because we talk about, we talk about everything. We talk health. I was trying to talk about autism and ADHD.
Yeah, I know.
This is autism awareness, but it's okay. We don't have to talk about it this month, but we got to talk about it.
No, hey, everybody, ask the doctor, can she come back? I'll bump another person, and she can come back on another night. And doc, and seriously, on the real side, your family, so
right.
All you got to do is listen. Sometimes she'll be like, "Yo, cuz I need you," and I got to be there. But cuz if you want to, you can pick a Wednesday.
Okay.
If that works for you.
Yeah.
And we can come back and we can talk about autism, or we can do another night. So you pick a Wednesday this month, and we'll rock out with that.
Okay.
And Colin had something that he wanted to say before we let you go. He says, I now wear the Libre, Libre 2 sensor to monitor my diabetes, blood sugar, and I send that info to my primary care doctor every month. Some folks see their PC quarterly. Mine sees me monthly, physically.
Good.
But with that info that I send monthly. Doc, listen, I love you. I know it's that time. Tell my cousin, let me know when you get him. I'll talk to y'all when you pick him up. Anything else you want to say to the people before you get out of here?
They better send you some information, so I can, if they diabetic or pre-diabetic, I will update them on Captivita.
All right. Okay. All right, definitely. Everybody, that's Dr. Marilyn Corder. Listen, this is Real Talk Chronicles. Doc, be careful out there. You in a good spot?
I'm in a good spot. Now I got to catch up with your cousin Fred, because we had to take 2 cars, because they're bringing it. They 6 people bringing a lot of stuff for the next 6 months.
Oh, they staying 6 months?
Yes.
Oh, so I'm gonna come down there.
Yes. Yes.
All right. Love you, cuz. I'll talk to you later.
Bye, guys. Stay healthy. All right. Let's make it happen. Bye.
That's it. Let's a second. Everybody. So that was Dr. Corder. Listen, what more can I say, yo? Really. I'm being honest with that. Listen, please help Real Talk Chronicles grow. I don't listen. Ollie, you know, everybody, y'all, some of y'all know, I could throw a party. I just mentioned Boo, like the 16th. It's about to be crazy. It's the easiest thing I could do. And Colin and Stefania, that's not the Real Talk Chronicles. We're still going to have a private get together with that. And not private, just the people that want to come out and meet the Real Talk Chronicles people. Maybe I'll get Dr. Marilyn Corder to come up for that too. Um, but listen, share it. Why keep the information to yourself? All you got to do, if you're watching it from my page right now, um, go under the share button and share it to your page and make it a watch party. If it's on YouTube, I'll put the YouTube thing up tomorrow, or you can go to YouTube and share it. Quiet's kept. Doctor is on Facebook. Um, I don't know how often she is, but she is on Facebook. I appreciate the love that you give my family. I appreciate the love that you show me. What's up, Sally? I see you, my man Marcella's in the building. Everybody, I got to give my man a shout out. You know, my dog and shit. Sally and I used to rock it out. You know, appreciate you. Stefania said, yeah, worldnews.com. Definitely, Ollie. You know, Sharon, great show. Thank you, everybody. I appreciate you. I appreciate you all. Lisa, I'm a survivor. What's up? Please go back and watch the show, everybody. I'm gonna get out of here in a minute. I just want to run down the sponsors again. Like I said, it's sponsored by Melba Wilson's restaurant, Soul Food Restaurant. Now, unless you guys listen, and also too, I just had to cut that real quick. If you especially you want the doctor to come back, everybody, pressure me to pressure her. You know what I'm saying? I can give her another show. I can cut out a show, or I can add another show. Like I said, I only do them 2 a month. I mean, I do her once a month. But ask her to come back the next time you have her. You know, email her, like, you know, share the email. Ask her to come back. She'll come back if you ask her. I think she'll come back and she'll give you 2 a month. You know, and I appreciate my big cuz so much, because let me tell you something. She's picking up her son. Her husband. I'm trying to get her and her husband on. I love to have both of them. I laugh when we got a joke within the family. One time they were talking about some medical stuff, and you know, I was poking the bear a little bit, and then they weren't agreeing with each other, and it was hilarious. So I said, "Yo, Fred, don't get in the doghouse." You know what I'm saying? You know, everybody knows that once you're married, you know, you ain't gonna try to get in the doghouse with your wife. So definitely, like, put some pressure on her to get her to come back and do more. You know, I'll have as much as she comes back. But you know what's so funny? Because she loves me and she loves people. My cousin is one person that really is about trying to save some lives. You know, she's not that person that's just out here uh, writing prescriptions and just to get you out her office. Like I said, this is free. This is just love. You know, she's trying to help me build my brand. This is her brand too. Like I said, you know, this is my co-host. This is why she's up there with me. Listen, I'm a diabetic too. I know a bunch of you in here are diabetics. So, you know, if this information didn't help you, and then maybe somebody you love is a diabetic, listening to the stories, you go back, please give the time and location for April 16th. It's at Row House at 115th and 8th Avenue, between 1 and 8. If you're trying to make reservations, call Row House directly. Um, yes. So yeah, like, get her back. Also, you know, it's sponsored by a bunch of things. I got Reggie Wells, the legendary Reggie Wells, in here. This is his speakers too. Reggie's in here. You can hit him up if you want these speakers. This quality sound. The Real Talk Chronicles are sponsored by Reggie Wells Quality Sound. These speakers, they have good sound. He charges. There's 2 of them. He charges $85. If you mention Real Talk Chronicles, you can hit him up. If you're Facebook friends with him or not, you can hit him up, and he'll give them to you for $75. But you got to mention Real Talk Chronicles now. Speakers are damn good. It's also sponsored by Soft Illusions Art Gallery. It's sponsored by a bunch of things. Like I said, get the doctor back in, everybody. Work on her. When you see her, bombard her with stuff like, yo, doctor, you know, please come back. What's up, Rochelle? How are you? Just ask the doctor to come back. She will come back. She does her thing. She's phenomenal. You know, like I Malia and I pluck her brain. She'll call Stefania. You see, you already developed a relationship with her. I know Zetine, she's come through on her promises. Stefania, correct me if I'm wrong. If she told you to email her about something, does she reply and then she gets back to you, right? I mean, my cousin is everywhere. Her multitasking game is crazy, you know. Lena, like you said, you're a type 2 diabetic too. Bridget, you too, right? I'm a new diabetic. Yeah, I mean, we all are. So you know, we got to take care of ourselves, man. I mean, I want to see all of us here together, you know, and laughing and meeting and kicking it. Thank you, Stefani. Yes, she's a woman of her word. Absolutely, man. So everybody, this is Real Talk Chronicles. I'm your host, Bill Forster. Richard Williams, you know, let me just run down the thing. The first Monday of the month, Assemblyman Al Taylor. We've been having some stuff. We talked about reform and stuff like that. So if you missed that show, go to YouTube and look at Real Talk Chronicles. And we talked about bail reform. We got it in. We got it in hard and heavy. The second Monday of the month is Dr. Marilyn Corder, which is today. So you already see what kind of information she gives up and she puts it down. She lays it down hard. The third Monday of the month is as Allison Williams, the first lady of Def Jam. Just Call My Name. Phenomenal artist. Allison was just in a diabetic coma. So she's doing good. She's getting her voice back. She's out here performing. I'm going to make sure she listens to this show too. Again, she definitely should have been on this show. The fourth Monday of the month is Pastor Kevin Graves, and he might try to have a surprise. If not, we'll try to see if we can get the doctor to come back on his show. He's working on some stuff. And of course, on Wednesdays, we have retired Sergeant Kevin Branzetti. We have retired Lieutenant Charles Chuck Richards. And we have community advocate Richard Williams. And of course, yours truly, retired Detective Bill Forster. I'll wear that hat for that. And we break down situations and things like that with law enforcement and just anything that we talk about. But the one thing about it, we can talk about anything with all of them. Everybody's intertwined, and you know, Doc can get it in. You know, she's a conscious. You know, as you can see, you know, I got good people in my family. We kind of, you know, her son's a psychiatrist. Her daughter's into medicine. Her husband. That's a family of learned doctors, yo. You know what I'm saying? Shout out to my cousin Marquita that she was in the building tonight. Yeah, Doris, definitely. Yes, please. You know, shout out to everybody that chimed in tonight. Hey, Ruthie, what's going on? So listen, I'm gonna make sure my numbers is right. You know what I'm saying? You know, so we gotta always just check ourselves. I'll see you Wednesday. Remember, Row House, the Saturday coming up. Come by. Have a drink with me, say hi, even if you can't get the brunch rest, because it's like I said, it's a brunch day party. Wear your mask if you feel in a certain way. I get it. Make sure you're vaccinated. Hopefully, you know, if you're not, definitely wear that mask unless you're eating. Like I said, Ingram Taxes, Real Talk Chronicles sponsored. I'm so glad the sponsors are coming into. Sponsored by Ingram Taxes. There isn't any taxes too big or too small. Jacob was in the building tonight. Sponsored the Soft Illusions Art Gallery. That's my wife's business, her and her mother. So always appreciate if you look on that site. Maybe you'll see something you want. Sponsored by my homie, my dog, Reggie Wells Quality Sound Speakers. Listen, they go for $85. He sells them for $75 if you mention Real Talk Chronicles. Listen. The Daily Arts of Survival magazine. Everybody, the #1 magazine on Amazon in lieu of martial artists. These are some people where you see a lot of black and brown and white martial artists, but these are people that you may have grown up with. A lot of these martial artists are from New York City. You know, people that you don't even know that have had credentials. Also, too, wait a minute, let me just say this. Yours truly. Wait a minute now. I gotta pick myself up. I made the magazine. Yes, I am a martial artist. Yes. So I did my thing. I still do my thing. You know what I'm saying? So I talk about my career in law enforcement on Amazon. Chocolat Restaurant, Mr. Leon Ellis, for the support, and Harlem Underground, his clothing shop. You can buy his clothes online, and of course, the talented Melba Wilson. Shout out to Melba. Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster. Please share it, subscribe to it, watch us, share the love. Humility is a beautiful thing, and I try to have that with this. Thank you, everybody. I'll talk to you later.